In this video we are going to see the fourth heart sound. So it is S4, that is S4. It is always a pathological heart sound. Now mechanism by which it is produced. Now the fourth heart sound is mainly produced due to the active forceful contraction of the atria against a non-compliant ventricle. So what happens in this is that the ventricle is non-compliant, means whatever the blood will entering into the ventricle in the rapid filling phase, the ventricle will be not so compliant to include or accommodate that volume. So atria has to apply more pressure to include the volume coming from the atria. So atria will increase the pressure by generating the contraction. So this atrial contraction we hear as a S4. So this is indicative of again that the ventricle is completely non-compliant. Now the causes here can be if the ventricle is unable to expand, as there is restriction for the ventricle to expand, as in the restrictive cardiomyopathy it can occur, or if there is diastolic dysfunction. So this is how S4 is produced. This is the mechanism we have seen. Now there are causes. In the causes we have to remember that all the causes of concentric left ventricular hypertrophy. Now which are the causes of concentric left ventricular hypertrophy? One is aortic stenosis, second is systemic hypertension, then there is obstructive cardiomyopathy, hypertrophic obstructive cardiomyopathy. All these causes will lead to concentric LVH. So why this will cause S4? In cases of systemic hypertension, there is almost always an increase in the left ventricular pressure, and due to increase in this left ventricular pressure, the atria has to overcome this increase in the ventricular pressure, by which atrial contraction should be very strong. So S4 is produced. In cases of hypertrophic obstructive cardiomyopathy, there is obstruction to the outflow to the blood, and because of this obstruction to the outflow to the ventricle, the pressure inside the ventricle increases, which atria has to overcome. So again the atria need forceful contraction to overcome the ventricle. So these are the causes for S4. Now second cause, this was the first cause. Second cause is all the causes of right-sided ventricular hypertrophy. So which are the causes? Pulmonary stenosis, pulmonary arterial hypertension, and restrictive cardiomyopathy. Restrictive, as I have told you that there is some restriction for the heart muscle, due to which the ventricle become non-compliant. So pulmonary stenosis, pulmonary arterial hypertension, and restrictive cardiomyopathy. Third cause is, now we will see the third cause. Third cause is acute coronary syndrome. That is coronary artery disease, and it can be ischemia or infarction. Now why in acute coronary syndrome S4 will occur? In ischemia and infarction there is a diastolic dysfunction. Again we know that due to diastolic dysfunction ventricle become non-compliant, so atria has to apply more pressure to overcome the ventricular pressure. So in these cases acute coronary syndrome, again ischemia, infarction occur. So these are the causes for fourth heart sound, because of which the S4 will be there. Now we have to draw the S4. In cases of drawing the S4, we will be knowing that S1 and S2, this period is systole, and S2 to S1, this period is diastole. So again, if we try to differentiate between S3 and S4, to differentiate, if the sound is more closer to S1, it is always been S3, and if this sound is more before the S1, then it is the S4 sound. So S4 is called as pre-diastolic sound, and S3 is called as proto-diastolic sound. It is also called as ventricular gallop. So this is how we will draw, and these are their alternative names in the diastole. So both S3 S4 appears in the diastole, but we have to see whether it is coming nearly after S2 or nearly before the S1 sound. So one important point to remember that the S4 is produced due to active contraction of atria, active forceful contraction of atria, atrial contraction. So in cases of atrial fibrillation, S4 will not be produced, as there will be no contraction of the atria. So this has to be remembered, that in cases of atrial fibrillation, S4 will be absent, as there will be no production of the atrial contraction. Correlation with JVP is, if there is right ventricular, right sided S4 is present, it is associated with prominent A wave in JVP, prominent A wave in JVP. So this is to be remembered about JVP, that it correlates with the prominent A wave, as there is increase in the right ventricular diastolic pressure, because of which there will be prominent A wave. Now correlation with AS, correlation with aortic stenosis. Now in the aortic stenosis, if S4 is present, it indicates that severity of AS. It correlates with the severity. It is one of the indicator of severity of aortic stenosis, indicator of severity of aortic stenosis. So if S4 is present, it indicates that the AS is severe. In terms of correlation with myocardial disease, then S4 helps to differentiate between dilated and restrictive cardiomyopathy, because it will be the feature of restrictive cardiomyopathy, as we have seen that there will be diastolic dysfunction in the ventricle, as in dilated cardiomyopathy S4 is not a feature. So it differentiates between the dilated and restrictive cardiomyopathy.